Hey, everybody. Let's go ahead and take your questions. You can unmute yourself, type in, go ahead and fire away.
And go ahead, Linda, then Ralph.
Hey, Linda.
Hey, hi Greg. Hi
Hey.
Sam. Hi everybody. Good to be back. Um, Greg, I've been working with the three brains stuff,
Mm-hmm.
going up, going down, and a question arises for me when you have led us in the process of going down.
Mm-hmm.
You guide us to do it where, we focus on the brain and then the crown and then the solar plexus and the back heart and then the
Mm-hmm.
sex and the Mingmen. I'm I'm constantly drawn to doing it a different way, and I just kind of want to check in and see if it's okay to do it this way, if there's any cautions. My impulse when I
It,
come down is to do crown and brain, back heart, solar plexus, Mingmen,
yeah.
sex.
There's no cautions. The reason that we do it the other way is that with your awareness there, it kind of stirs things up, and then like when you're on the brain, it's fortifying a little bit, but then it stirs things up a little bit. Like, so there'll be a little bit of displaced energy, like lower vibrational energy. And so you go to the crown to transmute it. And so when you transmute it first, you might leave stuff that lingers there and not necessarily like clean it up. I mean, it might get cleaned up in other ways, but you're hitting those three centers for transmutation so that you like whatever you're stirring up or fleshing out, you just transmute it and get rid of it.
Okay.
Yeah.
Okay. That's a different thing.
Part of the thing, because I even catch myself doing that. Part of that is like doing like Kundalini versions of Kundalini practices, you would just go crown, brain, like,
Yes.
you would just go down like that.
Yes.
And so it's a little bit of like, wait, what am I doing? Because like when I'm doing it myself and I start getting a little expanded, I have to stop and think about it for a minute. Like, wait, what? And then I like, okay, there we go. Because it's different than doing those Kundalini practices.
Okay.
Yeah.
Okay. That helps me a lot. Thank
Yeah.
you.
So
Okay.
that's probably why um even when I write it out, sometimes I still even have to watch to make sure that I don't flip it because that just seems like so normal.
Yeah, it feels
Yeah.
like a really
Yeah.
natural thing to
Yeah.
do, right? But it's serving a different purpose if we do it the other way.
Yeah. I mean, it's not going to cause a problem. It's not going to clean it up as well. Like
Gotcha.
it's just an efficiency thing.
Okay.
And
Understood.
so, like if I go through and kind of make that mistake, like if I'm trying to go solar plexus back heart, but I go back heart, solar plexus, I don't even go back because I'll do a few cycles of it. I'll just like get it on the next round. Like it's not like you have to stop and like redo it. Just kind of keep moving and yeah.
Okay.
Yeah.
Okay, good. And
How's
when
that
we,
treating you, by the way?
oh, it's amazing to me that particular thing, I
Yeah.
really find that I have more energy in my day when
Yeah.
I start my day with it. I find I'm more clear through the day.
Yeah.
I really notice a difference when I do it and when I don't.
Yeah. It's magical. Like it's like I say that, but it makes you learn better. It makes you innovate. And like I feel like I'm in motion, where sometimes I go, oh, I got to think about it. Well, I guess I got to get up and get doing stuff. When I do that, like I don't think about it. I just get up
Exactly.
and start doing stuff. Yeah.
Exactly. Everything just kind of clicks right along and
Yeah.
everything gets
Yeah.
done. And yeah, yeah, it is magical
Yeah.
actually.
Yeah. Like in my younger days, I used to call that practice. I'd be talking to my friends or whatever. I go, yeah, I do this anti-procrastination technique. And that's what it is, because it just makes you don't like hesitate or think about it. You just go, you
Right.
know.
And for me, that also translates into more joy in doing what I'm doing.
Yeah. Oh yeah.
Yeah.
Yeah. Yeah.
So one more
Yeah.
quick question. Oh,
I guess it's like for me, and I don't know about for you, but like when I do that on a regular basis, I get stuck in my head a lot less. You know
mm-hmm,
what I mean? Like
mm-hmm.
I don't know. It's easy to start talking yourself into something, out of something, hesitating, whatever.
Right.
You know.
Right. Yeah. Okay, one more quick question.
Sure.
You had recommended to me, and I've been using it every night since you did more than a month ago, Sylvester Pine on my wrists to help me at night with the kind of agitation that seemed to keep me awake or made it hard for me to go back to sleep.
Mhm.
And but I was just curious, I don't understand, what is Sylvester Pine? What is it doing? Like what are the
So,
properties?
yeah, so one of the things that it works with is like sometimes agitation can be in the nervous system, or it could be an aspect of where the body, like the mode of repairing itself. And part of what Sylvester Pine does is it elevates your body's production of cortisone. And so it helps the body go into a deeper like repair mode, and it helps to take like agitation out of the nervous system. Like for example, like when somebody has urgency to urinate, or like the urge is like often and intense, part of that isn't, some of it might be the bladder and the kidneys and all that, but sometimes it's actually more agitation in the nervous system than it is a bladder issue. And so if you calm down the nerves, that bladder issue will resolve itself. And so one of the ways that you treat things like that is, instead of looking at it from the point of view of a symptom, you go, okay, the body needs to repair itself. Like you keep shoving, it's the idea of rest and repair, but instead of the rest, you just are pushing the body to, okay, like repair yourself, like repair the body. And it's more of like a state that the body's in. And so when you start stimulating these aspects where they repair themselves, part of what happens is the body starts going, okay, let's repair this. And then it goes, well, if we're going to do this, we need to sleep better. Like, it's almost like doing the other side of the coin. Instead of just trying to sleep like deeper or better, you go, well, what's the things that make me sleep? And then you start stimulating those pieces. And so the stimulating the potential for the body to repair itself, for one, it makes it easier to treat something because it's like energetically it kind of like comes to the surface more. It's like easier access. But the stimulation of the repair mode, um it's like an indirect way of making the body sleep more, like it, or like go into even not maybe sleeping more, but maybe deeper. Like sometimes that's more, sometimes it's deeper, depending on the person.
Mhm. Yeah, I have found it to really the night, if I skip a night, I don't relax as much. Like I
Yeah,
don't, and I
yeah,
do get up more often to feel like, oh, I have to urinate,
right,
and
right.
it's remarkable to me the difference. I can really notice when I use it.
Sylvester Pine's amazing. Like
Yeah.
like it's really kind of a quiet little oil, and it doesn't have a strong scent, and you don't really think of pine for a lot of things, but for stuff like that, it was really good. I was treating somebody that I think she said she had been dealing with urgency to urinate and um like intensity. Like, when it would come up, it was like, I gotta get to the bathroom right now. And she said 35 years, like a little over 35 years. And we had her start doing the Sylvester Pine, and she was like, yeah, I've done all kinds of medications and things. And man, the Sylvester Pine just knocked it right out. And she kind of said, at first she had to really take it use it a couple of times a day. And then it got down to once a day. And then she started saying after a while, like after a few months, she goes, she could go like a day or two and didn't do it, but like at least 3 or 4 times a week she was doing it.
Mm.
And so like over a period of time, because what you're doing is you're teaching the nervous system to like function in a different way, like behave in a different way. And so at first you're having to stay on top of it. But then as time goes by, the nervous system gets used to this new way of functioning, and you kind of have started this momentum going in that direction. And so after a while, you can start doing less and less and start backing off, and it will continue to move in that direction. But you're basically re-educating the nerves to behave differently, you know. And so it's not a symptom oriented approach. I mean, you're dealing with symptoms, but you wouldn't necessarily think of Pine, Sylvester Pine treating like a lot of urinary tract stuff. But you would use it even like in arthritis. You would use it like anytime the body is like the nerves are agitated or there's degeneration in the body. And the part of the reason is it just makes the body move a little bit deeper into repairing itself.
Hmm. It's
Yeah.
making me wonder about what about somebody who has been through cancer in the area, like she had some work done with the bladder and they had to remove something, and she might have had a hysterectomy, but she's having issues a year later with her bladder.
Oh
And
yeah,
the doctors are
that's
like, don't know. It's not an infection. It's not this, it's not that.
right.
But it's pain all the time. And
Yeah. I definitely would probably do that. Like I'd say for her, like even 3 or 4 drops, maybe even 3 times a day at first. And then as it would start to calm down, you could diminish it. But there so many layers of trauma with that, and the the level of agitation that can happen in the nervous system. I mean, if you look at like where are the more intense places where there's neural activity, and it's the three brains, the brain, the gut, and the sex organ area. Like that's why the three brains. And so you have a big supply of blood in that area, and anytime you have a lot of neural activity, there's always a big supply of blood, more so, like more concentrated areas of blood. And so when there's like trauma or like surgeries or, like you said, like cancer and whatever treatment that they did, all that stuff's agitated. Like, so it has to constantly be like calmed down. The other thing that you might find soothing is using like yarrow internally. She wouldn't do it daily, but like yarrow, like maybe a few times a week. Because it keeps calming down like agitation in the body, and like being like, when I say triggered, I don't always mean emotional or mental triggering, but like sometimes like movement will trigger like reactions in the body, or like excessive hot or cold, or whatever it is. Like when the body's been traumatized like that, it can get triggered in like weird, odd ways. And so the yarrow can be good for calming down those, like it's good for calming down emotional mental triggers, but it's really good for calming down triggers in the body that is from like injury or like a procedure. So the story with Achilles, back in the day, is that he would use yarrow to treat the soldiers, his soldiers, when they would get injured with weapons made of iron. And so that's the story. And so, but if you think about it, it's not just like, oh, there was a cut or there's a blow. It was usually that area got hit really hard, or if something went in, somebody twisted it, or like it causes like this really bad response in the body. And even when you calm down the bleeding, the agitation continues the degeneration in the body. And so you're not just trying to, like, first thing, you're trying to stop the bleeding and then start reducing the inflammation, make sure there's no infection. But like a deeper level of treating something like that is even though all those things get controlled, there's still a level of degeneration that's happening in the body, like a momentum that's been moved forward in the body, that you calm all those things down. It doesn't mean that that momentum is stopped. Like that continual degeneration will happen. And so you see sometimes when somebody has had like a car accident, or some physical trauma, and they're recovering and everything, and you don't see them for a year or two, and all of a sudden, like, you see them and their hair's white, and like the body looked like it aged kind of quickly. It's because that degeneration just kept going, even though the wound was calmed, and taken care of. The degeneration continued. And so things like yarrow will slow down that degenerative momentum that comes from like injuries like that. And so I'd put the thing that she went through with the cancer and the treatment and whatever, I'd put that in the realm of the degeneration that kind of continues to happen. And so the more, like in cancer patients, you can calm that kind of stuff down, the better they recover. Like, because they go through a treatment that's very debilitating.
Right.
A lot of times, if you treat that all through the treatment, when the cancer stuff's all done and treatment's done, they're just kind of okay. Like, they don't have the massive recovery that you would think they would have.
Mm, good to know. Okay,
Yeah.
thank you. And the Sylvester Pine is not internal, it's just on the wrists.
Yeah, just on the wrist. Yeah, real simple, real just straightforward on the wrist. And like sometimes if you get tired of putting it on the wrist, you put it on the temples,
Mm.
or the tops of the feet.
Hmm.
The reason to do the wrist is because there's not very much fatty tissue there. Where, like, if you do the other side, it has to go through some fatty tissue to get to the bloodstream. But here, your veins are exposed, and you put it there, and it goes right to the right into the blood. And so the same with the temples, and same on the tops of the feet.
Terrific. Thank you so much.
You're so welcome.
And then go ahead, Ralph, then Lolly.
Hey, Ralph.
Hey, Greg.
Hey, how are you?
Well, I'm still recovering from the soul guidance class.
Yeah,
Um,
it was
this,
an intense one, wasn't it?
well, yeah, it was intense, and I was having body stuff going on at the same time.
Mm.
I started out having diarrhea about halfway through the class, and
Oh, wow.
yeah, I did, and anyway, I had started with diarrhea a week and a half ago on Saturday night. It considered through Sunday. By Monday, I was feeling mostly awake, mostly okay, but I was very, very tired. And so I've been very, very tired ever since, and it's still going on now. So just talking to Linda, I'm going, well, maybe I've got some yarrow. Maybe I'll slam some of that.
Yeah, what's going on? I mean, yarrow always feels nice. Like, I think,
Well,
but
thank you, but something's definitely out of place at the moment.
yeah. So you know what I would do is I would use like probably like hyssop or Solomon's hyssop,
Mhm.
but do the 4 quadrants.
Okay,
And part of, it sounds like it was happening during the class, but there it's probably something in the past and not something current, but there is a lot of projections at you.
okay,
And so like even when you go through and you clean up the body and stuff, you got this like coming in at you.
hmm,
And so hyssop's really good for breaking all that down.
okay,
And so that's what I would do. I would just um maybe every night for like a week, just like even if you're feeling better, like just keep doing the quadrants for like 15-20 minutes.
hmm,
And if you do a little longer, great. Even if you want to do like a hyssop salt bath or something, or even wear a little bit of hyssop on your wrist,
hmm.
or on your chest or something like that. But I would work that for a good week or so.
Okay,
Yeah, it
all
just
right.
looks like I mean when the industry kind of shifted and changed with your work, um was there a lot of drama? You know what I mean? Like there's people
Well, it
upset,
was,
people
it,
fighting, like
it was,
aggressive maneuvers, things like that.
it was a very gradual thing. And if
Mhm.
somebody wasn't paying attention, they just think that, oh, well, they just closed down this one particular line or something. So no, it wasn't a big, it was only dramatic for the people that were directly impacted by what was going on.
Okay. Well, somewhere you got a bunch of I thought maybe it was there, but
Yeah.
you got a bunch of stuff projected at you from somewhere.
Okay.
It
All
all
right.
looks related too. It's like
Yeah.
it's not like it's just willy-nilly. It's like it's all got a theme.
Okay.
Yeah. I don't know if that helps figuring that out, but it doesn't really matter who it is, just get it off
Yeah.
you.
Yeah.
Get it off.
Well, yeah. As one of my teachers said, it's all energy.
Yeah, yeah. And
Uh,
if you're not upsetting some people, you're not doing it right.
yeah.
Mhm.
Okay. All right. Thank you. I'll run this and let you know how it goes.
Okay.
And then go ahead, Lolly, then Cynthia.
Hey, Lolly.
Hi. So, few things. So last week we talked about the trigger points blend. You mentioned it really briefly, and I'm wondering, what's in the blend?
The trigger point you said, right?
Yeah.
It's ginger CO2, which is like a fancy ginger, and then helichrysum, larch, milfoil, anise, thyme thuyano, and palo santo.
Um,
I missed one, but okay. So I got ginger CO2, helichrysum, larch, milfoil, thyme, thujanol, palo santo,
Anise.
Anise.
Mhm.
So, okay, thank you. And yeah, and the reason it came up last week is because we talked about all the stuff that I have going on with my back, with my jaw, and you mentioned ginger
Mhm.
that I still
Mhm.
need to order. So should I still go with just ginger, or would the trigger point blend be better for me? Or both?
Um, yeah, it could go both ways. Sometimes I just use ginger for that, and sometimes I do use the trigger point blend. Um, I'm gonna say maybe like first time around, like ginger, just ginger by itself.
Okay,
Yeah.
okay. Sounds good.
So
So yeah,
like you're doing it in a body tonic?
I don't know. You're doing the body tonic, so I
Yeah,
can use
I
it.
would do
Yes.
it in I would do it in a body tonic, and the reason
Yeah.
why is like when I make the ginger body tonics, not that I make a bunch of them, but when I do, um, I actually add a little bit of saffron, and saffron is very good. Like I add the saffron tincture,
Mhm.
and it's a very good antispasmodic. It's
Okay.
like crazy good antispasmodic. It's just you can't use big dosages of it, and because it's like it's so can be so relaxing um to the spat, like say you put it on your low back all the time, you would start decreasing the amount or the frequency that you would urinate because everything gets so
Wow.
like
Wow.
your body wouldn't push out the urine anymore. Like it would, but it just, instead of going to the bathroom, you maybe might only go like half as many times in a day.
Mhm.
So, like the dosage that I put in that body tonic is good to be able to use every day. But like if you did like a
Mhm.
solid dose on an area, you could quiet down like the urinary tract, for example.
Okay. Interesting. Okay. So
Mm.
yes, I need to order that. And I was planning to order the body tonic. So okay, so I'll do that. And then so if we're talking about saffron, so the saffron body tonic, which I have from
Mhm.
one of the classes,
Mhm.
so that would be like a similar, well, by itself,
Well,
then it
you need the
basically makes the
ginger.
body.
Yeah, you need
Yeah.
the ginger. Like
Yeah,
so,
yeah, but
I you need the ginger more than you need the saffron. Like the saffron will
yes,
be
but
okay, but if you have that
so
body tonic, you could add ginger to it.
N- So no, I would still have you do that because I actually don't have either.
Okay.
But then the saffron body tonic by itself, you would use it for what? To relax the
Yeah, same
body?
way. Yeah, yeah, you would. Well, you in that class, it was for the fourth aspect of the auric waves.
Right.
But like if you're just using it for body stuff and not really looking at the energetic component, it will take tension and spasms out of the body
Mm-hmm.
significantly, especially like chronic spasms, and not necessarily like I would say spasms, not just like tension and things. Like tension, it's okay, but like when that area is like really in spasm and won't let go,
Mm-hmm.
you know, like one of the oils that you can use is like wintergreen will do like really good on chronic spasms, but even that sometimes is like, the
Mm.
body's just so wound up. It's really what it is it's tense, but it's like in protective mode. Like, and so when
Mm-hmm.
you get the body like in a spasm like that, it's protecting something, and so the saffron will actually help that to unwind. But if there's just like general tension, it'll be
Mm-hmm.
okay, but it's not
Yeah.
amazing. But like when
Mm-hmm.
there's really like gnarly spasm, it's really good for that.
Okay. And that's why I like the ginger because the ginger would help the trigger points, and you like to combine the
Yeah,
saffron because that'll help with spasm.
you're not just looking at spasms, you're looking at the state of the body, and the spasms are a
Mm-hmm.
reflection of the state of the body.
Mm-hmm.
And so the reason you're using ginger is that you're trying to stimulate more movement toward the anabolic state when you're resting, which is where your body is going to repair itself. And uh, when you're sleeping, like when you get that restorative sleep, part of that restorative sleep is the anabolic state. And so sometimes we'll sleep, but we won't hit that anabolic state. And so when you don't hit that anabolic state, it's not just like, oh, well, I'm not repairing like I should. If you don't hit that anabolic state, then your body is doing what you call a catabolic state, which means if you don't hit that state, then your body is degenerating, like bottom line.
Mm-hmm.
Like that situation is either or, either you're getting repair work done or you're degenerating. And so you're using the ginger to keep pushing the body into a deeper state of repair mode while still treating some of the symptoms. You know, you're treating the spasms and, you know, tension and inflammation and all those kinds of things, but you're not completely focused on a symptom. You like step back and you're trying to nudge the body into a place where it will repair itself to a much higher degree. And so you're calming some symptoms down, but really the thing that's going to flip a switch, so to speak, is being able to hit that state while you're sleeping. And then everything starts to get easier to treat. You know, everything.
Yeah.
It's part of what, like when we're talking about the vibrational healing. So, you know, we have that new class coming up, but even this week in the Divine Self, it's starting to go into the vibrational state. Because if you look at, you know, we just did the whole aura series with the six, excuse me, the 6 aspects, or the 6 different aspects of the aura. Then, and the aura being the energetic mold or blueprint. So eventually the next phase is what starts getting physicalized in the body. And so if all the aura gets cleaned up, it starts changing the body and everything, but you have so much time, so many years or decades of that negativity, you know, be it that causes inflammation or body tension, whatever, has been physicalizing in the body. And it's not like a series of symptoms, it's actually like like states in the body. Like it's either in a state of repair or a state of degeneration. I mean, that's the easiest to talk about, is just either repair or degeneration. And so when you say you're raising the vibration of the body, what you're really saying is you're elevating the body to repair itself to a much higher degree. And then because you're raising the vibration of the body starts being able to process more energy from the soul, which means that the body then starts healing even faster. Like it needs the life force or the essence to be able to heal at a faster rate. And so just because things are cleaned up doesn't mean every body is in the same place for that rate of healing. You know, it's just like how we were talking about with actually it was before the Zoom, sorry, but I was talking to somebody and we were evaluating a particular person, and like even though you're doing all kinds of work on the person, the rate that the chakras are spinning and pumping is so slow that even when you try to push out the blockages, sometimes only a little comes out because the chakras aren't pumping like they should. And so it can't really absorb very much energy, and it can't really expel very much energy. So it's left in this state where it's just not going to really shift or change very much. And so part of the deeper level of healing, you go through and you clean up the aura, the body usually starts getting better. But then if you go, okay, but I'm not patient for this to unwind on its own, I want to accelerate this process. The next progressive step is then you start treating vibrational components throughout the body and through different systems. And so by going through and doing that, you increase the way that the energy body functions so that it can start pumping out a lot more of the stagnant or stale energy. Because if you look at somebody clairvoyantly, you know how like we say the bottom of the aura is the dirtiest part of the aura, like down by the feet. And you know, you go through and you clean it up and the person feels better. It's tied a lot to the stress response. But if you even take a step back from that it's really like the knees down, but really you could even say the hips down, but the knees down definitely. And it's not always the body. You know, you're mixing with energy from the earth, and you're also dealing with people in general, like the collective unconscious. So it's not necessarily just like your family or the people at work, but you know, you're in a town where everybody's stressed out, it's going to hit your energy body in a particular way. And if your energy body is refined enough, it might hit the body, but then the body just kicks it right back out. But when the body is stagnant and like kind of stale, it hits and it just stays. Like it doesn't get flushed out because there's not a lot of energy coming in and flushing it out. And so that's why meditation is helpful, is it can accelerate that process of flushing things out. But you know, everybody's at different places for whatever reason, you know. And so you're trying to do both. And you could say the rate that the chakras pump is still tied to that anabolic state. It's not the only factor, but it's a big factor. And so I mean, it makes sense energetically. If your body is going to heal and go into that anabolic state, then your chakras need to be able to take in a lot of energy and needs to be able to flush out a lot of energy, because a lot of the energy that is stuck in the body is old. Like it's not like it's, oh, this happened last week or this happened this month. It's like this happened 30 years ago and your body still hasn't shaken it off, you know. Going back to even the injury like we're talking about with the yarrow is you know, sometimes we have either a psychological trauma or a physical trauma that can rock the body so bad that the body just starts going into a tailspin, and it might be slow, but it's in a tailspin, and it just continues to spiral even though symptoms got better and the situation's better and mentally, emotionally you feel better. That all works, but the body is still spiraling downward. And so, you know, a perfect example of that is whiplash. You know, that's why it's such a weird thing. Sometimes people will not feel that bad, sometimes 30 days out, 60 days out, you know, even 3-4 months. And then all of a sudden they'll start going, oh God, like, you know, my shoulders kind of been bothering me, my neck hurts and blood pressure goes up, and you know, a year later starting to get a little bit of a migraine, and you know, like just symptoms will keep appearing. It's because the momentum is there and you have to slow down the momentum, you know. And so it's a vibration, but it's a negative vibration, it's a bad vibration, but it just keeps like that spiraling down. So you know, that's why I like when we do stuff like over the weekend, last weekend, we did a thing with Larch in the class. Was that a free class? No, that was the
That was
astrology
yeah.
Astrology class. But like the Larch targets like the bronchioles and some of the triggers that would make your body go into fight flight and tense up the diaphragm and the bronchioles and some of the other processes, but that also would contribute to anabolic. But for you, I think ginger is like the best start.
Yeah, I'll do that. And then also in that thing, I've actually been doing what you told me with sitting with my back to the wall and the legs straight, which is
Oh yeah, how's that treating you?
It's interesting. It's kind of, you would think it's really basic, and I do that in yoga, but interestingly enough, when I do that with the back to the wall, all of a sudden my
Yeah.
chest feels really
Yeah.
restrictive. I'm like, is
I
that
know, huh? Like it's
Oh my
so
God.
funny because I remember the very first time I was doing it, I was like, I literally was like, I was saying it out loud. This is stupid. Like, why sitting up against a wall? Really, this is going to be super therapeutic. And then, like 2 minutes into it, I was like, I don't know if I can do this. Like,
Oh my God.
how bad is that? Um,
So-
there's something about like you're not just sitting at that angle, but you're supporting their back, but then the back can also relax like into and it starts shifting the body around. And so it's based on the idea of positional release. And so positional release, it's different. It's like almost the opposite of stretching. You know how stretching you would um like stretch the muscle, like you bend over and you're touching your toes for your hamstrings. This positional release is the opposite. You almost bring the two ends, the attachments together, like closer together. So instead of stretching them, you bring them closer together so that they don't have any sort of tension or anything in it. And you're allowing it to go into a relaxed state. And the reason you have to keep doing it over and over again is the muscles sometimes will like freak out because of that. Like, you're bringing them together and the muscles will start bouncing around and shifting, and you almost have to ride that wave out a little bit. But then after a while, you've re-educated them in a way that they release. They release very differently than you would do with stretching. And so the psoas is a really good example of like unwinding that. Is, sometimes you can get it to unwind with stretching, but one of the better ways to do it is bringing those two things together, because it's always got tension in it. So sometimes when you stretch it, it almost like aggravates it more. But when you bring the two ends together and you just let it like have the space to relax, you're taking the aggravation out, and eventually it will start to let go. So that's why I have you do the up against the wall first and then do the cobra. Is like you relax it and then you gently stretch it. And so it's a very good combo. Like, so the next phase, like if you want, like I would still do the wall, the 90-degree angle, but like the next phase will be still doing the cobra second, but you would still do the wall, but you'll add laying on the floor, like, on your back, and you'll, bring your legs up, like your knees up to your chest, but you kind of slide up against the couch is a good place to do it. So your butt's up against the couch. And so your legs are going up at a 90-degree angle, and then you let the calves rest on the couch. You know what I mean? So you do that, and again, like 15 or 20 minutes or something, and it's another way of taking the pressure off the psoas, and it will deepen the release. But usually I start people off with the one I have you doing up against the wall and just legs straight out.
And then also when you do the one with the cuffs are, so basically your legs are on the couch, but against the couch,
your
and the
legs are still up at a 90-degree, but then you bend your
but
calf.
then
Right.
okay.
Yeah.
And what's also interesting with my back to the wall is that I have a curve in my back, so it doesn't really go straight to the wall. So I really have to like move myself so the lower back touches the wall. So it's it's been
good. Yeah.
so hey, but I'm doing it. So no, it's good. So thank you.
And the bummer thing about it is it is a little slow. Like, it's like, it would be awesome if you could do it like twice and it's like, man, I feel so fixed. But it's just one of those things where you're just kind of nudging the body again and again in a particular direction. But what you're doing is you're undoing that negative vibration that's going through the body, or that momentum of the damage. And so it can be effective. The only times I've seen it not be completely effective is, and you're using oils and herbs and things and, healings. And so when you got that combination, it's usually pretty effective, except for like if there's an area that's like bone on bone or something like that,
Mhm.
then it's a little bit harder because that only gets so much better. You know what I mean?
Mhm.
It doesn't always repair. You know,
Mhm.
you can get it better, but like when it's bone on bone, it's a whole nother ball of wax.
Okay. Thank you. I'll keep doing those. I'll order the ginger and yeah. And I've also been working with pain soothe, which seems to be doing a good
What
job
is it?
on the pain soothe,
Oh yeah, pain soothes.
the
Yeah,
ointment.
yeah.
Yeah. So I'm doing that on my lower back, and that seems to be yeah. So yeah, so thank you for that.
Yeah.
And then the other thing I'm wondering about, we talked about the other classes that we did with the Auric series. We talked about like the Auric programming and the intuition and how to kind of maybe try and translate it to when doing energy healing, which is not that simple or it's obviously not as effective. But I'm wondering, is there any way to do that with the auric waves or with the dynamics of the aura? Is there anything that can be?
I mean, you could, but it would have to be like from a super intuitive state, you know. Like I guess what I'm saying is technique is not going to get you there. Like you
Oh yeah.
almost have to be able to access it internally. And so
Mhm.
um it's possible, but it's almost like you have to do it from the inside out. Like you have to be able to access it internally. And then, you know, techniques would be very similar. You would just be being able to access something deeper from it. It's not like there's a different technique for it, if that makes sense. It's like a
So,
mantra. Like if you think about Om, like if a homeless person chants Om, you know, I don't know why I say a homeless person, but like, you know, so
okay, yeah,
like,
okay,
you
yeah,
know,
the idea.
normal
Okay.
person, you know, and then the Dalai Lama comes in and goes, let me chant Om. Same word, but the energy passing
Yeah.
through it is very different. It's the
Okay.
same. It's the same with the
Mm-hmm.
techniques. It's the kind of energy passing through is as important, if not more important, than the technique itself.
Yeah. Okay. Okay. Yeah, makes sense.
Yeah. So like
Um,
doing the class, you know, that's the thing. And the same with the, you know, the tools, like the tantric tools, like, you know, things like this.
yeah.
Like you're stimulating things to wake things up inside you so that when you go back to do your normal everyday, like, you know, techniques and things like that, like more juice is coming through. Like, you know,
Mm-hmm.
it's
Yeah.
opening things up. And so it's almost like you're breathing life into the things you're doing rather than trying to learn something new.
Mm-hmm. I like that, and it makes perfect sense. Okay.
Mhm.
Yeah. Okay. Because I can see how everything is really shifting, and what I'm doing is it's like a completely different way of healing. Yeah. Okay.
Mhm.
Thank you.
I mean,
Um,
it's just the other side of the coin. You know what I
yeah.
mean? It's like in the West and a lot of things that are technique oriented, it's it's still like a very like intellectual. You know what I
Mm-hmm.
mean? You're still trying to make something happen, but really it's the what flows through. The technique gets you there, but you know that's why sometimes people will teach a technique of like say energy healing. They go, but before you do that, meditate before you do the healing or something.
Mm-hmm.
It's so that something else is coming through.
Mm-hmm.
And so the technique is good, but then the essence or the thing that comes through is as important, if not more important.
Mm-hmm. Okay. Thank you.
Yeah.
It's also interesting when I'm doing like even meditations and I'm using the Dorje, the
Mhm.
meditation itself is
Sure. Yeah.
so much deeper than when yeah.
Yeah.
Mm-hmm.
Yeah. Yeah.
And then I think one last thing, talking about intuition. We do all these practices and all these things to stimulate the intuition, which is, it's great. And it's needed for everything and healing in life. And so I had a situation, well, as you know, I didn't end up traveling. So even with making that decision, I mean, yes, you did the scanning, I scanned as well, and everything was a no. But
Yeah.
the things that were no, it wasn't the intellectual mind saying this is not a good idea. It was purely like it was intuition.
Mhm.
And the last few days, it's been like I don't even like can't even put my finger on that. It's a no. That's what I feel like.
Mhm.
That's what it feels right. So I guess my question is, because I've been kind of struggling with that a little bit, of how to know if this is like my intuition, trust that that's like what I'm following, or it's like tinted with something else. Like if it's
Sure.
pure intuition, like
Yeah,
it's yeah.
yeah. So the thing, there's no like way where you can go, oh, I can do this and I can tell if it's right or wrong.
Yeah.
But I will say, the more you do it, the more, when it's or right, or you're in the flow of things, it's there's like a certainty. And even like if you think about like how you're talking about the trip, it's like I'm trying to make sense out of it, but I don't know why. And sometimes it also is not exactly what you were wanting or hoping for. And it's like, where usually when it's something else, like everything fits the way you want it to be, or everything fits the way that you're trying to do something. You know what I mean? It's like
Mm-hmm.
everything's a little too perfect, and you're a little too certain about it, where like the intuition, there's like an inner knowing, and the more that you do it, the more you'll be able to go, that's right brain, that's left brain. Like you'll be able to start to tell.
Mm-hmm.
you know
And it was interesting because I knew it was, and I even eliminated anything else that might be like some kind of a reason for me not to want to go, just to really clear things. Yeah, but it was a good exercise of like,
yeah.
follow what you know is
and
right. Yeah.
and but because we're talking about you going to a war zone, so like that,
Yeah.
that becomes easy to like figure out, like, well, probably because I don't know that it was like something was probably gonna happen to you, but you're gonna be in
Yeah.
a war zone. Like, talk about stress levels, and
Yeah.
that's one thing. So sometimes it's just like keeping you out of something that is gonna, how we're talking about that degeneration in the body, like you're almost like
Mm-hmm.
protecting the body
Mm-hmm.
from going into that degenerative state. And it
Mm-hmm.
might not be an incident. It might not be that
Yeah.
somebody did something. It might not be,
Mm-hmm.
like that I get. And this might be
Mm-hmm.
like, I'm not sure why. Um, yeah. There's been a couple times where I was really driven to like do something and make something happen. And it was very intellectual. Like in the moment, I was just like, I had a goal. This was on the list. It's going to get done. And I pushed and pushed and pushed to get it done. And something really not very pleasant happened that was very avoidable. But I was just too in my mind. Like I was too in the
Mm-hmm.
intellect. And I didn't pay attention to the signs. You know what I mean?
Mm-hmm.
And so, that intuitive part, there always will be a little bit of uncertainty.
Mm-hmm.
There's always a little bit of like, not quite sure what's happening here. And so, like, sometimes when I have something going on, sometimes it's very clear, this is intuition. And then if I'm not sure, I'll go, okay, I have to sit with this for a little bit. Give me an hour, give me a day, whatever it is. And I try not to grind on the details. I just sit with it, and over a little period of time, you'll get a definite like yes or no.
Mm-hmm.
It's very
Yeah.
definite. And if you get a little too stuck in your head, like pump the brakes, give yourself a little bit of time to like process it. And it's not even processing it, you're sitting with it. Because if you catch yourself like going, well, what about this? What about that? And if I do this, like you're already too much in intellect. So if you're trying to let like the intuition or the heart guide you, you just go, okay, I'm going to sit and I'm going to wait for the answer. And then over a period of time, it'll start sinking in and it's like, yeah, it's a no, you know.
Yeah.
You know, like we had one, remember that last year with Boston?
Oh, yeah.
And you know, we only would go there like once a year, and we hadn't been there for like a year or two because of the pandemic, and we're getting ready to go. And you know, in person they didn't have very many students, so it wasn't even like enough to cover costs and all this. And you know, I was not, like on paper I shouldn't go, but like I just couldn't say I'm not going to go. And you know, Samantha and I kept talking about it, and I was like, I don't know, I just feel like we should go. And like there was no rhyme or reason why it was the right thing. And you know, we were getting our tires rotated, remember? And we were sitting there, and I was like, okay, right now, if I say we're not going, how does that make you feel? And Samantha started crying. And I was like, is there a reason why you're crying? She goes, no, I have no idea. So I was like, okay, well, this goes against all logic, but we're going to go, you know, we won't make expenses and everything, but for whatever reason, we're going to go. And as soon as we got there, you know, we saw the organizer and her husband. As soon as we walked in the door and I saw the husband, I was like, that's why we're coming. That's the last time we saw him. You know, he passed away shortly after that. Like, soon as we walked in, I was like, this is why we couldn't let it go. Intellectually, I never would have gone there with it in my head. But as soon as I saw him, I was like, you know, he passed away like a month later. Yeah. Yeah. I mean, I did healings on him all through the weekend. I was like, I mean, I was doing like 3 and 4 hour healings on him. I was like, you know, let's just clean you up. And nah, he was already on his way out. Yeah.
Yeah, it's amazing how you never know what, and things just feel what they feel, and then learning to follow that.
Because you're not always going to know why. You know, that's the hard thing with intuition. You don't always know why. You'll eventually know. But like, you know, if you think about like, okay, intuition keeps you from doing something where maybe you would have gotten into an accident, or maybe you would have gotten mugged or something, and then you didn't do it and none of that happened. You're not going to know why. You know what I mean?
Yeah.
But had you gone, you would have known why. But,
exactly.
you know what I mean? Like in
yeah. And usually with me, if I go too much back and forth and I start like, I know it's not.
Yeah, that's you trying to talk yourself in or out of something. Yeah, that's
exactly. Yeah.
And
that's
then always a red
once
flag for me. Yeah.
Yeah.
For myself.
And then once you're secure with your decision, whatever it may be, then you're fine. And then the people around you just follow with that. So that also worked well. So so thank you. Thank you for that. And just one last question to follow up on Linda's question about somebody who just recently had cancer. As far as like, let's say, so the person had cancer, she had surgery, everything was removed. Looks like she won't even need to get any radiation, possibly no chemo. They will put her probably on those pills for like 5 years that are very, very strong. Not very, very strong and can create a lot of side effects as well. But is there something really after the body is going through some type of cancer, something that can really keep the body strong, the systems working properly?
So you said there was chemo or radiation?
No, she's they caught it really early, breast cancer. They already did the surgery really fast. They took out whatever they saw. They said no radiation, chemo, she doesn't have to do chemo. She's like an in-between recommending it to her. She's probably not going to do it. But they still want her to take those pills. There's those, I forgot the name, really strong pills for 5 years.
It's a
That they
type of
give out to
chemo. The pills are a chemo, or
I have the name of the pill somewhere. I'm not, they're basically like, I think, hormones, and it's like a
okay, it's a
combination.
hormonal therapy. Okay, that was
Yeah,
my next question.
yeah.
You could go to a couple of things. You could use the Sylvester Pine. You could use the yarrow. You could use larch, or you could use all of them together. Like sometimes with the yarrow, because the thing with yarrow, especially when topically, it's okay, but when you're taking it internally,
Yeah, can't do more.
it's
Yeah.
like 3 weeks, and you need to take a little bit off. And
Mhm.
so sometimes what I do is I'll rotate the yarrow with like maybe a chamomile or something. And so like in that downtime, I'll still carry it through with like the chamomile, and then they can go back on it. The other one
So
to use
which,
there is
oh,
dark
oh,
blue tansy. You could use dark blue tansy on the in between times when you're dealing with that. But basically, like if you're looking at um, like cancer and like how it grew, lots of agitation in the body, lots of agitation in the vital centers, and there's usually um, an excess of lower emotions in the field. And so you have to flush out the lower emotion, and a lot of the lower emotions are in the kidneys and liver. And so it can be in the lungs too, but a lot of it's in the kidneys and liver. Um, I would probably emphasize more kidneys than liver, but cleaning the arms and legs a bunch, and then just doing a lot of things that are regenerative to the nervous system. So again, yarrows, chamomiles, even frankincense and myrrh can be fortifying to that. But one of the long-term things that I do sometimes is, it depends on the kind, but that shiso, that tree shiso, like I'll make a body tonic from that and have them put that on. It's very fortifying, and it helps to reduce the chaos in the body that caused that. But you also are looking at a lot of times with brain fatigue. So you want to treat brain fatigue with, especially in that particular case, with a lot of Spanish sage. All the sages will work, but Spanish sage you can give a much bigger dosage,
mhm.
and it's much more well tolerated by the body. Yeah.
And so what I'm wondering about, okay, so what I don't understand, so when you talk about yarrow and the blue oils, I know that you're taking them for 3 weeks on, 1 week off, and you explained with all the iron. But what I'm not understanding is so if I'm doing, let's say, yarrow for 3 weeks, the week off yarrow, you can go to one of the other blue oils and it's fine.
Yeah. Mhm.
So as long as it's not the same blue oil, you're okay, and you can alternate them.
Yeah, it's well, like, so for yarrow, like if you take it for a period of time, so the safety mechanism is don't do it more than 3 weeks. Like if you
Yeah.
have to, you could go longer, but over a period of time, it reduces the amount of iron that your body's
Mhm.
ability to process.
Yeah.
So German chamomile doesn't quite have that issue, but if you take German
Oh.
chamomile for long periods of time, it begins to elevate white blood cell count. So they have different reasons why you would
Oh.
only use it. So you're rotating it so that you're not getting the weird like fallout from using it so excessively. So it's not
Oh,
so much that they're blue, it's that they're very strong at doing a particular thing. And so you only want to use them for a little bit and then rotate it so that
yeah.
and all of this is internal. Topically,
Yeah.
game on. You can do it
Yeah,
all,
yeah.
but
And
internal, yeah, that's
I
why you would do
so
that.
what I didn't, okay, so I missed the part that each one of them has a different issue. I thought that each one, okay, so thank you for that. And then, yeah, also with that person, which I think probably kind of pushed whatever she had going on. She had cysts for a long time, and then she had actually a car accident. The car accident could have pushed the body to
It
like
always
something
does. Always
something
does.
that was already there, and it kind
Yeah.
of pushed it to manifest faster.
Yeah.
So
Every
yeah.
time it does. Every time.
Yeah. Okay. So basically you'll do all of that combination and just
Mhm.
doing that for a while. Or basically just an ongoing, right? Until what? Until the body is
It's hard to say. It's different from person to person, and so you treat for a while, and then at some point you go through and you do a little bit of a reevaluation.
yeah.
But that will be something to treat for a while.
Mm-hmm.
Yeah.
Yeah. Okay. Sounds good.
It's
Thank you
there's
so much.
lots of factors like age, health, previous injuries,
Yeah.
psychological makeup. There's so many factors that it's not always the same thing over and over again.
Mm-hmm. Yeah. Makes sense.
Yeah.
Yeah. Okay. Thank you so much.
You're so welcome. We are going to be addressing more of that. Like I'm trying to standardize our approach, like in the vibrational healing. We're going to be standardizing like how to address the degenerative states in the body. Especially you've cleaned up the aura at that point, then you're going deeper into like shifting the body into a state where it can heal faster or stop degenerating. But in that, you look at like a lot of cancers have most cancers have a lot of excess lower emotion that the body has generated. And so that usually is something malfunctioning in the immune system. And so you're looking at trying to improve the immune system's function, but you got to clear out all that stuff that got shoved in the garage of the body and it's getting stored there for whatever reason. You got to have a garage sale and get rid of all that crap. You know what I mean?
Yeah.
Just got to get it all out because even if you get and treat all the symptoms, the body is still not going to respond because of that. And so here's the difficult thing is there are certain like holistic practices and certain kinds of meditation, nothing that you guys do. So like, I'm not saying anything about anything you guys are doing, but there are certain practices where they're trying to do something good, but they're actually causing excess lower emotion in the body. And so after a while, what happens is the practitioners start having these health issues because of the practice. And so you still treat it in the same way, but it's not always because of an accident. It's not always because, it could be things at work or somebody's habit or a practice they're doing or, so.
Yeah, combination of, makes sense.
It's just almost like, you might not always know like what something looks like, but you know it when you see it. You know what I mean? It's that's what you're shooting for. I mean, that is the intuition. Like, I don't know what's going on, but I know it when I see it.
Yeah.
Yeah.
Okay, perfect. Thank you. And yeah, and
You
by the
know how
other,
I sharpened my skills with that? Working on animals because they can't communicate. So you have to sit and figure out, like you watch them walk, you watch them do things, you watch them interact. And then you're like, oh, God, what's going on with this? And then after a while, you start to get this thing about it's this. And so, you're still dealing with a symptom, but you're having to watch the behavior of an animal. You're having to watch, all kinds of things. And then you try to treat it. And you're honing your skill at being able to recognize something without having like the verbal stimuli or somebody, because even like when somebody comes in and says like, hey, I want a healing for this or healing for that, that's their interpretation of what's happening. And
Yes.
even if it came from a doctor, it's the doctor's interpretation. And it's not that the doctor's wrong, but for what you're doing, it might not be as valuable of information as versus what you can observe and see. And so like even when somebody says, this is what the doctor diagnosed, I go, okay, but then I still go through and go, but if I sit with it, what do I see?
Mhm.
You know?
Yeah, that was perfect. Thank you.
Yeah.
And then go ahead, Cynthia, then Robert.
Hey, Cynthia.
Let's get you unmuted there.
There we go. Okay. So when you were talking about injuries and calming things and so on with the oils, so my niece,
Mhm.
had the surgery and so on, still having some things continuing. Would yarrow or some of the oils that you were talking about?
For
that-
her, yarrow, by far, yarrow.
Okay.
Yeah. And get the tincture. The tincture has a bunch of the oil, essential oil in it, and the tincture, so it's like a broader spectrum, and it would be better for her.
Okay.
Yeah.
And then this is kind of a little bit different, not necessarily a physical issue, but an ongoing issue in general. So this is related to real estate and the real estate mystery that I have dealt with.
Mhm.
And so the title search came back, and the people involved, I believe I have found them and identified them as real. Am I correct? I mean, I was using search engines. I mean,
Wait,
Is-
so
we
say it
kept
to me
talking
again.
about it being muddy.
Oh, yeah, I see.
We've talked on and on about it being muddy. And of course, that man had called me as if it was something my deceased husband had bought before we ever met, not to get into all the details for everybody that's on here, but, and so then I had a title search done. So these unusual names, I think I've found these two people.
Why don't you type it in and I'll look at it and I'll text it back to
Okay.
you at some point.
And I can wait till we talk next too. I was trying to decide whether to.
I'd be curious though.
I was supposed to meet with the attorney tomorrow. Now I could walk in and say, let's table it until I think about this a little. But I was trying to decide whether to, like, rather than using his time.
Right. Text it me. I'll try to look at it tonight.
Okay, great. Thank you.
Thank you so much.
And then go ahead, Robert. Then we have some questions in chat too.
Hey, Mr. Robert.
Hey, Greg, how are you today?
Doing good. How about you?
I'm doing pretty good, thank you. So I have several questions, and they're not totally related, but they're questions. I noticed a new blend called Tendonitis, and you have it as an ointment and an oil and a body tonic. So can you tell me about when you use it and which of them you use in which situations?
Is that the one we just put on? Yeah, somebody
Yes.
had requested something for tendonitis. So you can do variations. Like a lot of times the use of helichrysum and Eucalyptus citrodora mixed in even amounts will be a treatment that you can use for tendonitis. And you can apply it neat. I actually like to rotate between using a body tonic and an ointment, because the issue is that the liniment is more penetrating and goes deeper.
And
And
liniment
then-
being body tonic.
Yeah, body tonic. I'm sorry, I always say liniment around here. So the body tonic goes deeper and is more penetrating to the areas, but the ointment, because it's based in like some oil like sesame oil or something, it's like a time release into that area. Right. So if you're treating tendonitis here, you put something neat, it hits the blood and then moves. And same with the body tonic. It will go deeper into that area, like into the tendons and sheaths, and then it moves. But the ointment, because the fatty oil and the essential oil are mixed, they eventually will separate. And so the fatty oil keeps it in this area, and then it does like a slow drip into the area. And so I kind of like to do both. You could do either, but some people like body tonics more, some people like ointments more.
So when you say
I-
both, are you saying like do the body tonic before bed and the ointment in the morning?
Yeah, and it could
Okay.
even be like one day I'm doing a body tonic, next day I'm doing an ointment. Like you could even do it like that, or you can do them both. Boom, body tonic, let it dry, slap the ointment on top of it. Because it's two different rates of delivery, two different time lengths of delivery, and so yeah, it's like I used to just refer to that as like a rotational approach, or a layered approach, where you layer like things on so that it absorbs at different rates. So the tendonitis blend is helichrysum, eucalyptus citrodora, and then also yarrow. Like so, the yarrow
Okay.
just adds an extra layer of inflammation, anti-inflammatory and antispasmodic components to it. So
Okay.
they're all kind of hitting that. The issue is that sometimes the tendon and sheath, they're getting irritated from the movement sometimes because there's already some inflammation, but it could also be there can be like a poor blood supply. There can be the bursa sac sometimes is inflamed as well. The eucalyptus citrodora and helichrysum together is very good for reducing inflammation in the muscle and then the tendon and sheath. But I find that the yarrow is a little bit better at dealing with the bursa, like the inflamed bursa.
Okay.
For the bursa sac to be inflamed, that usually means it's been there for a while. Like it might not have manifested as pain, but there's been an issue brewing there for a long period of time. And so when they tend to be a little bit more chronic, I throw more of the yarrow in. If it's not chronic, you still could do it with yarrow, but there's all these kind of variations that can happen with a tendon and sheath with tendonitis. Because really when you're dealing with the bursa sac getting involved, it's not tendonitis, it's tenosynovitis. So it just means the synovial sac is inflamed as well. And so a lot of times when people are saying tendonitis, it's actually tenosynovitis. But
Okay.
it's splitting hairs. Like it's not that big of a deal. It's just you kind of want to know what you're treating. And so the other thing that happens, the eucalyptus citrodora and helichrysum are very good for taking like the tension and denseness out of a tendon, because a tendon has very poor blood supply. That's why when somebody gets tendonitis, it doesn't respond very well or very quickly, is because like your muscle has very good blood supply, but when the tissue starts getting denser, it doesn't quite have the blood supply that the muscle does. So then when it needs to heal, it heals at a slower rate. Helichrysum opens up that tendon. And so sometimes the issue is that the tendon, like instead of just being, like the normal normal way, like say this is the tendon, sometimes there'll be little like frays off of the tendon. And so they'll be aggravating the sheath. Even when you calm it down, the sheath will keep getting aggravated, right? And so if it's straight up tendonitis, the helichrysum and Eucalyptus citriflora usually works. But when you start to have those little frays, again, I start using things that like yarrow or German chamomile to try to really calm down the inflammation, and sometimes I'll even drop the helichrysum and eucalyptus and go right to German chamomile and yarrow by itself. And it's to deal with those little frays, it doesn't make them go away, it just makes them like less aggravating, because the reason that I say that is, it's just like how we're talking about, like the body can get triggered in different ways. If there's like friction in the tendon and sheath, it's like it's sending off these like little triggers to the surrounding area that causes like an inflammatory response or an area to start tensing up to protect the joint. And by using like things like yarrow or German chamomile, you're calming down the inflammation, but you're also calming down the tendency for that injury to trigger the surrounding tissues. And then you don't have that normal like degenerative response. Like you're allowing it to kind of heal and like regenerate somewhat. And so usually something like that has been there for a long time. It's not like, oh, I did something and I frayed my tendons. It's usually a lot of repetition. Like the place I used to see it a lot was tennis players and checkout clerks, because they're just doing this all day. At some point they start wearing out those tendons, and the tennis player just always hitting really hard the same thing over and over. Pitchers and of both baseball and softball, I would see that there as well, because it's just a lot of repetitive motion. The tennis players and the checkout clerks, it was usually in the elbow or the wrist. The baseball player, the pitcher, or the softball player, it was usually in the shoulder.
So thinking of the ointment, obviously you can just apply it to the area.
Yeah.
Is part of my gut says it shouldn't be massaged in, it should just be applied.
No, you can massage it. Yeah.
Okay.
Yeah, you
Okay.
could totally massage it in. Yeah. I mean, it's kind of nice to kind of dig in and go, oh, that part hurts a little bit. Like, and the thing that I like about when you kind of massage it in a little bit, you kind of poke around and you can feel like the tightness or the denseness. And then as you treat it for a while, you go, oh, look, this is softening up, or this is starting to feel like it's relaxed, or, you can kind of see like how it's progressing.
Okay.
Yeah.
That makes sense. I was a little concerned because as you talk about those fraying, part of me says, yeah, you don't want to massage that.
Yeah, the massage shouldn't irritate it too much. I mean, movement is the thing that irritates it the most. So
okay, so massage,
shouldn't-
not movement.
Yeah, no.
Okay.
Yeah.
Good. Okay, so there's
Because like
that part.
there's well, you don't completely know, but like when you suspect that there's fraying in a tendon, usually the fraying usually happens just in the elbow wrist area. Like, unless they have some other repetitive thing that they're doing. But like with rest, it'll get better, and then you start moving again, and then boom, it goes right back. And then you rest and you get it better, and then you start doing it, and boom, it goes right back. Not like, oh, gradually, it's like it almost like comes back like
just as bad as it was.
Yeah, it's like and resting it made it completely feel better. You know what I mean? And so it doesn't mean 100% that there's phrase there, but it's a suspect. It's a person of interest. Like you
Okay.
start watching it and like, oh, I don't know about you.
Okay, so next question is about the class coming up, Vibrational Healing.
Mhm.
and you already talked a little bit about it. When I decide to take a class, most of the time I don't even read the description.
Mhm.
I just look at the title and go, oh yeah, I need to be there.
Mhm.
I'm called. This one I'm definitely called. I'm attending. Can you tell me more though? Because I know there's more.
Yeah, I mean it's you're dealing with state, like anytime you're dealing with vibration, you're dealing with the states of the body. So a couple of the big things that you're dealing with there, to even like begin elevating the vibration of the body, we look at it from an energetic point of view, and it kind of means like, oh well, meditation, or maybe you put a bunch of violet in the body, or you inhale things that are like violet, which are all true. But the thing that you're improving is anytime you improve or increase the anabolic state, right there, you're elevating the vibration of the body. And when the body's not like, the vibration's not very high, the body and the emotions of the mind are also in a degenerative state. And so you go through and you start putting the body in a more I mean, I've been saying restore, like I think in the notes I had like different terms, but restore is good, like you're rest and repair, or you're restoring the body, right? So if you break that down, like if we look at it from the point of view of physiology, you're elevating the anabolic state, which is restorative sleep, right? You're you're calming down homeostasis, you're making it more pliable and more effective, and you're calming down agitation in the body, which is the allostasis, being excessive or agitated. So there's all some terms that we've used before, but part of what you're looking at is you're looking at three things. So you start pushing the body into an anabolic state, and one of the manifestations of being in a degenerative state is trigger points. Like trigger points, like if a person is covered and like has several areas where there's trigger point activity, it's because the body is degenerating. Like it's not just it had an injury, it's like continuing to degenerate. And so when there's trigger points, it causes neurological dysfunction. It usually causes lymphatic dysfunction, and it causes emotional issues, like just unregulated emotions, and it causes cognitive decline. Like you just don't process things cognitively like you should. And so you can actually even kind of chart out like certain trigger points will affect certain kinds of cognitive functions and processes. And so once you start pushing the body in that direction, then you're boiling down where you're looking at three factors. One is, and I'm going to be talking about it from an energetic point of view, just so people don't have to learn a bunch of anatomy and physiology. And so you're looking at the frequency of the body. So if you look at the chakras, yes, the energy centers, and they have like particular functions and they do specific things, but what they're doing is each chakra has a like a kind of vibration, so your body's vibrating at a rate depending on the mix of the chakras, right? And so, like if somebody's very heart-centered versus somebody who's very goal-oriented and very competitive in work, you can say, oh yeah, they like those two people have this behavior and that behavior. But you could also say that person's very heart-centered and that person's very solar plexus centered. Another way of saying it, they have two different vibratory rates, like, and it doesn't mean you're always in that rate, but when you're at home, hopefully your heart's big, and when you're at work, it's but you could say you have many faces. You have many faces of like when the chakras function at different ways. right? And so that frequency or that vibratory rate dictates how much energy your chakras take in and how much goes out. So basically, it's how much the chakras pump. And right there, the rate of pumping also dictates the level or degree of soul contact. If there's a lot of damage to the body, the soul starts to withdraw a bit, and then the chakra starts slowing down. So it can't push out the negative energy, and it doesn't really absorb very good energy, right? And so when you improve the frequency of the body, you start not just kicking out the energy um, of the injury or the condition or the symptom. You start kicking out the history in your body that made those conditions happen, right? It's not just like you're going like, oh, I threw my back out. Well, maybe you had a lot of stress, maybe there was an injury, maybe there was a lot of emotional things going on at some point. And so over 20 or 30 years, all of that contributed to your back being a particular way. You're treating the symptom, right? You're treating the back, but you also have that history that you need to deal with. And without having to go through and evaluate, this happened, that happened, because even when you do that, it doesn't really affect anything. Like, you might go and release some trauma from the past and it helps, but it's like getting punched in the stomach every day for like 20 years. Like, and all of a sudden it stops. It's like you feel better, but every time somebody walks up to you, like you protect your gut and your body just goes, enough. Like I can't handle anymore. It's had too much history. There's too much water under the bridge. So that is directly reflected in how much the chakras will pump, right? And so when you start working the frequency, it's like the body starts kicking out like diseased energy or low vibrational energy, old emotional energy, non-specific. It's not like you're even thinking about a particular situation. The body just starts kicking it out. Then you go to a thing that you call resonance. And resonance is like the energies that you attract from the environment, and then the message you send out. And it's really more to like people than anything. It's that idea of like attracting like, so resonance directly corresponds to the ego. And you know how we go through and we clean up the arms and legs and things like this, and we're always like pushing for the arms to be cleaned up, the arms to be relaxed, the legs to be cleaned up, the legs to be relaxed. We think of the ego as being in the mind or in the brain, but the ego is actually in your bones. And this is actually even talked about in Astara. It's in most inner teachings, especially in the Theosophical Society, that the ego is a reflection of the bone marrow. And same with the Egyptian tradition, inner teaching, same with the Buddhist tradition. That's why you see like a lot of times in Buddhist practices, like there'll be like, a Buddha, and then down at the corner, there might be like a little skeleton or something. It's actually, that's a reflection of the ego. And I mean, it's a reflection of a few things, but ego is going to fit here. And so when you're going through and working the resonance, you're refining the ego so that you don't generate the emotional and mental contamination to your own body. Because most times that's been generated by conditioning, especially when you were young. Young traumatic events, agitation in the body, stresses, injuries, whatever that might be. And so the working of the resonance, you're letting things out of the arms and legs, but even deeper, the bone marrow. And to take it a step further, the ego is also a byproduct of the karmic imagery in the blood. And so when you're treating the bone marrow, you're bringing a light to like the very seeds that cause the suffering in your life. You know, we kind of have been working our way through, especially auric waves and then the dynamics of the aura. You really have set the stage to be able to go deeper in and extract that out of the system, like to flesh that karmic imagery out, or to refine it so that it's very easy to cognitively process and learn. And so by working the resonance, you keep flushing it out of the arms and legs, which means you're changing your automatic behavior and your automatic thinking. You know, those things that we call like being triggered. It's a whole series of things. It's not just like a mental reaction or emotional reaction or a body reaction. It's this whole series of events that then causes you to get triggered. And so you're going through and refining that in the body. When you did it in the auric waves and the dynamics of the aura, you did it in the aura. Like, you know, you cleaned it out of the aura. And if you didn't do it there, it's hard to do it in the body. Like you can do it, but it takes longer. Cleaning up the aura really allows for you to go deep and then flush it out, and it just stays out. Where if you didn't do the aura, you would flush it out, it'd hit the aura, and then some of it would come back, and then you'd flush it out, and then it would come back. You know, not all of it, but some of it, right? And then the vibrational harmonics is about being able to establish a pattern that then keeps reproducing itself. So this is like a vibrational way of increasing the repair activity in the body. Like you're setting like a good pattern, and then when you're working the harmonic component, you're duplicating like a positive pattern, a positive momentum that just keeps going deeper and deeper. And so when you do all of these together, it starts flushing out the things in the body that is conditioning that has caused the disease. So if you think about like when you go through and you treat something in a very symptom oriented way, like sometimes it works, sometimes it doesn't. One person it works, sometimes it doesn't. Really why it works sometimes and then doesn't is completely based on the vibratory rate of the body or the vibration of the body. And so when the person responds very quickly, the vibration has been elevated, like not enough things have knocked the body down, right? And sometimes it's not even like an injury. It could be you're at work and you're the boss and 25 people grind on you all the time because they don't like what you're doing. And so you're not doing anything wrong, but you got all these things happening. Like I used to work for this one CEO. Well, no, he wasn't a CEO at the time. He was I think he was like a VP of something. You know, one part of the company. And he had 8,000 employees under him. And I'd get a call and he'd go, "Hey, I need you to do your thing. I'm having bad luck again." And I'd go, "What do you mean bad luck?" And he's like, "Well, everything's just going wrong. I can't think straight. Like my health's going downhill. Like my family's fighting all the time. You know, like just all this whole series of like bad things are happening." And like I go through, I'd clean up the stuff that's being projected at him, because that's what it was. It was a bunch of people projecting hostility at him. I'd clean it up and I'd shift the vibration, and he said his blood pressure would regulate, like his health issues would go back and and be fine, and his body would start regenerating. The family got along, but even when he would travel and stuff, he goes, I stopped having my bad luck. Like everything started flowing again, because you're treating frequency, vibration, and the harmonics. And so in different traditions, you could say even like amen or ahum, things of this nature is like a form of, you say it at the end of the prayer. It's a type of harmonics. Like you're going, okay, this is what I'm praying for. I'm bringing in divine energy. Amen. And it's a way of trying to set that pattern to continue to physicalize first in your aura and then in the body. And in the I want to say it was European, let's say just European like inner esoteric things. They would, like whenever they would do a prayer or make a wish, like how we do materialization, they would end it with fiat, fiat, fiat. Like the car Fiat, Fiat. And it's like a form of like so be it, but it's a little bit stronger. In the Tibetan tradition, it's tatatsu. Like you hear me sometimes at the end, I'll go tatatsu, tatatsu, tatatsu. That means like continue that pattern manifesting. And so you combine those three components with working the anabolic state, which is repair, and decreasing the catabolic state, which is degeneration. And you're mixing chocolate and peanut butter when it comes to healing the body. It's an accelerated way to treat something, but it's more potent when you've cleaned up the aura. But even if you hadn't done that, it still works. It's just it's stronger when the aura has been cleaned up. And you can do them both kind of simultaneously, but then the next phase is then you can go back to symptom-oriented treatments, and the symptom-oriented approaches usually start working.
Okay.
Because those three, part of what they do, like if you stood back and looked at them energetically, they're very activating to the ajna. And part of why it's activating to the ajna is it begins sequencing the chakras. With the aura, you're working the aura. You're working all these different aspects of the aura. And that will begin to physicalize and start to change the body, change the energy body, start to affect the chakras. But if you look at most health issues or most psychological issues, if you look at the energy body, the ajna is always small, right? It's because the chakras are not sequenced. And it doesn't mean just balanced. It means like how they function in all the different situations. Like going back to the person's very big-hearted at home, but they go to work and they can't really function that well. Like they're not able to get down to business and get things done. And then the person who gets things done at work comes home and then is abrasive with everybody. Like their chakras, their energy body is sequenced in certain situations, but it's not sequenced enough to where it can transition from one situation to another situation to another situation, or different bodily functions, right? And so when you look at it, the ajna starts to activate and it starts sequencing the chakras so that, depending on the situation, your energy body adapts to whatever that situation is, right? And so, it's just like what I said before. Inside of you, there's many faces, but what happens a lot of times is that we only access one or two faces in us, but there's the work side, there's the partner side, there's the grandkid side, there's the doing your hobby side, all these little different things that you do. In a way, you're accessing different pieces of yourself. But when things aren't sequenced, you're always doing it from like your workplace or family man face or whatever it is. And so it's the ability to be very fluid in each situation depending on what needs to happen, if that makes sense.
I feel even stronger now that I need to be in the class. That's pretty obvious.
Most inner practices, one of the big things is either refining or diminishing the ego, is what they'll say. But really what that means is refining and diminishing karmic imagery. Like that's really what they're saying. And so if you look at like in a lot of different traditions, they'll do some practice where they are doing an energetic purification of the blood. Like the Catholics, it's drinking the wine. It's consecrated, they drink it, it has a little bit of a purifying effect on the wine. Basically what they're doing is they're refining and diminishing karmic imagery or the ego. The Buddhists do it in a different way, same idea, but sometimes they use wine, sometimes they use really strong black tea. Different traditions will use different things. Black tea will work if it's consecrated.
Okay.
Yeah.
Now, earlier in study group today, you talked about real briefly the free class coming up, the divine self.
Mm-hmm.
And you said that there's some overlap or one leads to the other.
Yeah. The divine self is kind of like an introduction to the theory.
Okay.
You know what I mean? We're going to talk it out before we do it. So that way, by the time we get to the vibrational healing, you have a little bit of some of the lingo and the ideas and the theories, because we'll be working it, you'll be shifting, and so at least you have that. And it could be something that maybe somebody new could start delving into, or if you're dealing with a client, you could do the divine self class to get them up and going without going into a deep dive.
Okay.
I think in the divine, isn't that the one that has the frequency?
Mm-hmm.
Yeah. So it already has like a blend that like it has like the kit has the frequency and it has the incense.
Mm-hmm.
And so like, about a half hour before we get there, I was on a meeting. I started burning some of the frequency incense. And Samantha was like, oh, something's coming out of me. Something's weird. But it's because like even the incense, it's starting to affect the energy body, and her body started kicking out like just old stresses and stuff. Who knows what it was about, but
Okay.
wasn't what like she was having a bad day, but just stuff started purging out of her system. And then it, a couple minutes and then it passed. But if you looked at her, you could see like old stagnant energy coming out of her body. Like it looks like grayish white. It's not like, inflammation will look more like dark red or grayish red. This was just like a gray white, like you can tell it's not like pure light. It's just the stuff that happens. You know what I mean?
So that sort of leads to a bigger question that I've been trying to figure out how to ask or how to describe. A lot of times I have clients who I'd like to bring into like a series of classes, and I don't mean a series, let's say the Auric series, but a sequence of classes that would work towards something.
Sure.
And there's nothing clearly defined. I can pull classes and I can say, okay, here's the things I feel you should do. But it might be nice if there was a sequence for one thing and a sequence for something else and a third
Yeah.
sequence.
Yeah. So like we have the aura series, and then there's going to be like a little vibrational series, right? But like to do like a simplified version, like when I put out the booklet for the aura series, it's going to have like a very simplified version that you could do without having to go through and do the in-depth stuff. So you remember when we did the what was it called? The energetics of the nervous system or something?
Yeah, I think that's exactly what
Yeah.
it's called.
Remember the energetics of the nervous system? So we did the aura, we did the health rays, we did cords, we did the spine, we did the arms and the legs. So that's a good foundational class for anybody. And then you're working all those components, but you're not doing it in depth like you would the class. But if it's a new person or a person in the general public, it's a very good place to start. And then the vibrational class would be or not the vibrational class, the divine self would be the thing that you can bring into doing a little deeper. It would be like the next progressive phase. And the angels in the aura is like a simplified version of working the aura series. It's just like single oils, but it's a way to like a softer, slower version of doing what we do in the deep class. And so you could combine that somehow. Like I would say probably do energetics of the nervous system, then the angels, the aura and the angels, and then the divine self. And that could just be a little unit just by itself.
Okay. And so sort of a foundational series, like
Yeah.
a intro.
Right. And then from there, you just start dropping into like when you go through and you lay that foundation, then just start dropping into treating the symptoms, because you're going to have a much higher potential for success rather than just going right to the symptoms. And so after that, then you would just go, okay, respiratory system, go to a respiratory class. Digestive system, go to that digestive, all those free classes where we do,
Right.
respiratory function, this function, and you talk about symptoms. So after you're cleaning up the energy body and you're cleaning up the patterns and you're raising the vibration. And then after that, just go right to symptom oriented treatment.
Okay.
Yeah.
And would you suggest that the people buy the class and do it, or as a healer, I walk them through this?
I would walk them through it.
Okay.
I would walk them through it at first, just because you can gauge like how well they're doing it, and you might tell them to do the class and
And they don't do it.
yeah, they're not going to do it. Or like I just had somebody who had this chronic health issue, and I gave them something to do, and they did it like once or twice, and then they go, I stopped doing it, it didn't work. I was like, well, we got like, it's chronic, like you got to treat it for like a period of time. It's not going to get better with just a single treatment. I mean, the symptoms might diminish, but like this, you got to treat it for a while. And so like at first, like as a practitioner, I would say hold their hand a little bit. And you can kind of tell there's going to be some people who are motivated and they're like, let me at this. And then there's some people that are like, I don't know. And you can kind of gauge like the rate that they're doing it. But even the ones that are like, I don't know, you still can come back to that vibrational component, because a lot of times that's the chakras aren't pumping like they should. It comes down to those three components. And so if you elevate that, then the person usually starts making more effort to heal. And like I go back to that situation, it was many years ago. And we were treating, for some reason, I was specializing in addiction at the time. And there's just a bunch of these teenage kids that were like, they were high school or just out of high school, that were using meth. And the kids weren't coming in, but the moms or the family was real concerned. And so I just, I didn't know what to do. So we just did like a really basic thing of just doing something to like elevate the vibration of the body. You kind of do it with like prayer and a little bit of energy work. And in 30 days, there was four subjects that we were treating. In 30 days, 3 of them asked to go to rehab. And the 4th one, it took about 45 days. But they all went to rehab on their own. And they were running away. They were doing every negative behavior that you could think of. They were not going to pull out of it. If you said, hey, let's maybe do something to help you feel better, they would start saying profanity. They were just, they were pretty brutal. And we started treating them. And then over a period of time, they asked for help themselves. And why that worked is it elevated the vibration of the body to a point where they started kicking that stuff off. And the drugs were too strong for them to stop on their own, but they wanted stop, so they asked for help. And so it's not always about an addiction, but sometimes when people aren't that invested in getting better, it still comes down to that vibratory rate. It doesn't resonate with them, or they don't know better, or whatever it is, they're not motivated. But basically when you go, oh, that person is stuck, you could say they're really stuck because the chakras aren't pumping, like all those things aren't happening, so they are literally energetically stuck.
Okay, great. Thank you very much, Greg.
Yeah.
And then go ahead, Regina, then Cynthia.
Hey, Regina.
Hey, good evening.
Hey, how are you?
I'm pretty good. I was listening to everything that was being asked and said, and earlier on when you talked about the trauma, I just wanted to mention the dizziness that I had mentioned before to you in the class. So that I had gotten the anise, and I've been taking it daily, probably for about a week now. So still having periods of it, have had different workings with it, feeling it from the back of my neck down to my shoulders. So
okay, so is it still lasting as long or still as intense?
I would say it's a little bit better, not as intense. And it's just so random. So everything that we've talked about tonight, the trauma, the unwinding of like a car accident was at that.
You had a bad one there. Like, what was that, 2 years ago?
2. It was just 2. Yeah.
I would say I still take the anise, but let's add like the larch in like topically, and so, like on the chest, but like on the neck, and then on your calves. Like, are your calves real tight? You do yoga all the time, so you're probably fine there, but what's the tension like in your calves?
That's what I don't really notice, the tension in my body. What is kind of interesting, how I am noticing it like all along the spine, even like lower, I'm just really feeling this correlation more between the neck and the pelvis. You know,
Right. Yeah.
because when one starts to release, the other one does. So
Yeah. Yeah, it's an osteopathic thing that we used to always say amongst each other is whatever the head is doing, the pelvis is doing. And whatever the pelvis is doing, the head is doing. Like, you
Right.
know, like they really kind of mirror each other. So if there's an alignment down low, there's an alignment issue up high.
Mhm.
And so if there's tension down low, something up high.
Mhm.
So let's have you do the large. I think that will actually help unwind some of that.
Okay.
Yeah.
All right.
And like 1 to 2 times daily.
Okay.
And Samantha will guide you to that.
Okay. All right. Great. All right. Thanks.
You're so-
And then go ahead, Cynthia, then Lolly.
Cynthia.
Okay. Could you elaborate just a little bit more about, well, basically the things you were talking about related to the bone marrow, and the ego. And then for me, I was immediately thinking about, family traits and
Yeah.
the tendency to have
Yeah.
leukemia, lymphoma, things that are related to bone marrow, in one way or another,
Oh,
as a blood production and so forth.
yeah, it's more about the energetic components like in the blood, like that. I mean, that would still be like a karmic imagery issue or a karmic issue. But you know, if you had that, the karma could manifest anywhere. And so, you know, in those particular cases, those are usually like karmic issues. Even though it's a health issue, it's still considered a karmic issue. And so, you know, all kinds of things can happen. And so it doesn't necessarily mean something more or less when it's happening with the marrow or like leukemia or something like that. But in the blood and in the marrow is these little pieces of like energetic, like pieces of information, and they circulate affecting your physiology, they affect your emotions, they affect your mind, they affect behavior, they affect thought processes, the things you're drawn to and not drawn to. And you know, some of it is the karma of your genetics, and then some of it is the karma of the soul. And so when you do blood purification processes, part of what you're doing is you're cleaning up and refining that karmic imagery. And then sometimes releasing, it's not the right way to say it, but you refine it and like kind of reduce your body's reaction to it, your body and emotion and mind. And with the stimulation of intuition, you kind of learn the lesson, you know. So like when they say, you know, one of the ways to break karmic patterns is to learn your lesson. It's the lessons are in the blood. And then how much intuition you have will directly dictate how much you learn that lesson or how much you keep repeating it. Like if you're an intellect, you keep repeating it. But if you're an intuition, you kind of learn the lesson and go, okay, I have to shift, I have to change, I have to do this, I have to do that, I have to think differently. You know, it just kind of starts happening. But when it's just stuck from the point of view of intellect, you just keep repeating it over and over again. And so by the time it gets there, that part of the ego that is in the psyche, in the mind, but the root causes are actually in the blood and the bone marrow. And so even when you're doing different practices, you know, different traditions will handle it slightly different ways. They're going after the same mechanics, but they'll do it differently. You know, a lot of times in the Tibetan tradition, you know, you'll see malas and they'll say, it's like made out of like yak bone or something, like some sort of bone, right? Part of why they use those bone malas or bone beads, or they'll have like little bone wrist things, is the even with it being like a yak bone or something, is it releases the things out of the bone marrow and out of the blood, but the bone is very stimulating to the intuitive mind. And so it releases it, and then it's like, okay, now learn the lesson. Like you're almost doing two things at once. Release it and then learn the lesson. And so you kind of like work through it. And so it's very opening to the arms and legs. And on the negative side, when the arms and legs are very congested, it causes dissociation. You know, you're not present. You're very deep in being triggered, automatic thinking, automatic behavior. When the arms and legs are very cleaned up, your ability to be present is much more substantial. You know, so part of being present is actually the purification of the arms and legs, but on a deeper level, the blood and the bone marrow. And so, like I said, like Catholics will drink wine, and like the Buddhists, you know, use this special object, and they put black tea in it, and then they drink it. Different traditions will do it in different ways. The Native Americans, it's the sweat lodge. You know, they do it in the sweat lodge.
Is, now I have blood purification spray that's from you.
That's
How-
cleaning up, that's that old that's cleaning up the, that's actually just cleaning up the inflammatory material in the blood.
Okay,
Yeah.
all right.
Yeah, God, I haven't made that in ages.
Probably need that too, but
Yeah, you know why? I used to make that all the time, but it there's an absolute in there. It was clover, red clover, and nobody makes it anymore. You know what
okay.
else does it though? Like it kind of cleans up that inflammatory material, is dark chocolate.
That's an easy habit to have.
Yeah.
Okay, thanks.
You're so welcome.
The blood purification oil we have now, is it a similar thing of what that blood
No,
purification
the
spray?
blood 1, 2, 3, and 4.
No, we just have a blood purification oil on the website. It's probably the old.
Yeah, it's probably the old one. Yeah,
Okay.
yeah. Like I haven't had that. We haven't been able to access that oil for like 3 or 4 years.
Oh, that's funny.
I still have a little tiny bit left, but yeah, we'll have to revisit that.
Just send it with chocolate or something.
Mm.
Just kidding. And then go ahead, Lolly.
Hey, quick one. So bug bites. I realized I'm itching like crazy. I have huge bug bites on my legs, both calves. It's itchy, it's red, it's swollen. I just put lavender, yarrow. I took German chamomile internally. What else?
Yeah, so I mean, all those are the right choices, but also I would say do something to reduce histamine levels.
I already took antihistamine. I have a small pill. I took that
How long ago did you take that?
10 minutes ago. It just
Yeah.
happened.
It should like give it like about 45 minutes and it should kick in. Yeah.
Is there
But
anything?
it's tied to, it's not an allergic reaction, but it's tied
Yes.
to same mechanisms, and
It's-
usually will calm it down.
I took it because I remember you mentioned that before.
Mhm.
Is there anything else that I can put on or take that would make it go away faster?
No, you did all the stuff.
I would do galbanum though, just because it can be so irritating, and the galbanum kind of just calms it
Yeah.
down for me, because
Yeah.
you know I get bites and I'm like,
Yeah. Yeah.
Topically,
You-
right?
Yeah.
oh,
Okay.
I would take galbanum internal.
Yeah.
even.
I'll do both.
And like something to slow down and deepen the breath.
Okay.
Yeah. Slowing down and
Okay.
deepening the breath slows down that process. You know,
Okay.
the agitation from the bite.
So you would do something like,
If you had larch, I would do larch, but if not,
I-
like hyssop, Sitka, something like that.
okay, perfect.
Herbal, anula, something like that.
Okay, yeah, I have, yeah, okay. Thank you. It's just been, yeah, pretty
Oh
insane.
yeah,
Thank
no,
you
they can
so
drive
much.
you crazy. Yeah,
Oh my God, thank you, thank you.
yeah.
Now we have some chat questions. Let's see how many we can get to because we're kind of short. Is Shibumi still good for the 3-brain
Yes.
protocol?
Yes.
Great. Question about class this weekend. If I ordered the 2 kits tonight, can the oils get to me by the weekend? Yes. Yes, I didn't read that before I read it to Greg. I would have answered you. My apologies. Yes, I am express shipping those kits. I will get it to you. A patient over 75 years old experiencing difficulty emptying bladder fully and pressure/flow of urine is too low. Is there anything like a protocol, oil protocol solution?
Are they male or female?
And you can type in or unmute yourself, whatever way you want to do it. Male.
Yeah, so I mean, you can start to use like some sort of diuretic, but that also could be swollen prostate. And so I mean, there's it's not on the site, but there's a kind of really funky eucalyptus that will help reduce the inflammation in the prostate.
The prostate just got operated on.
Yeah, that's probably why then. I use some anti-inflammatories like black seed. Just try to reduce the inflammation that way. And then if the flow is not picking up in 48 hours, I'd probably use a little bit of like lovage or something, but probably inflammation is a better target.
And then as far as the application of the black seed,
Internal, yeah.
right? 2 drops. with
I'd probably do
concentration.
3 or 4 drops. And I'd also use galbanum at the same time, like on the wrist, like 2 or 3 drops of galbanum. That's a very good combo that slows down the degeneration in the body and reduces the inflammation. And so I usually do that with injuries. And so even though it's a surgery, it's still a kind of the same kind of injury. So we got to get over to the prayer petition blessing, and thanks for a good night tonight. And join us tonight if you can, and if not, we have the study group for the class this last weekend tomorrow night, and free classes this weekend, so jump in if you can.